Hi, I'm Dr. Diana Gaines. I'm a licensed doctor of acupuncture practicing in New York City. I have a private practice in Midtown, and I work at a busy clinic in Soho, where combined I see about 100 patients a week. Here to talk to you today about Chinese medicine and depression. Depression affects estimated 400 million people in 2018. And we get those numbers from the World Health Organization, and those numbers refer to people who receive treatment for depression, ages 18 and older, and were classified under a classification system by the World Health Organization, referred to as F33, which is depression. Now, that number does not take into account adolescents, children, or people who didn't receive treatment. So that number could be much higher. And to kind of put that number into perspective, it's more than the entire population of the US and Canada combined. So it probably affects somebody you know, a friend, a family member, a colleague, and probably that individual, their first line of treatment is antidepressant medication. Antidepressant medication is very effective for some. It's not as effective for others. It works by affecting neurochemistry in the brain, and it's difficult to get that exact combination correct for everybody. Serum levels have to be reached in the blood. Effects don't happen immediately. So I'm here to talk to you today a little bit about how acupuncture might be helpful uh, as a treatment in depression, or as a way for your healthcare practitioner maybe to assess what might be the best antidepressant medication for you. Perhaps even to combine Chinese medicine and Western medication might be the right answer. Chinese medicine looks at depression a little bit differently than Western medicine does. We think about it as an excess or a deficiency in an organ system that might relate to feelings of depression. Typically, these organ systems in Chinese medicine are the lung, the spleen, the kidneys, and the liver. And each of these organ systems has an emotion that we associate with it in Chinese medicine. So, somebody who has an excess type of depression may feel angry or short tempered. Somebody who has a deficient type of depression may not want to get out of bed, may have lost interest in things that used to excite them. And if we think about it this way, the acupuncturist may ask the patient to describe how their feelings manifest. And this will help them to determine what might be the best course of treatment for them from an acupuncture standpoint or from a Chinese medicine standpoint. Herbs can be used, acupuncture can be used to help direct blood and nutrients to areas of deficiency or away from areas that have excess. In future videos, I will go into greater depth about how these emotions may be affiliated with different organ systems and give you some more information so that you can start to understand how we think about depression in Chinese medicine. But it should be known that in Chinese medicine, there's no stigma attached to emotional distress. We look at it more as the body's reaction to the things that go on around us. And so it may be a way for you to speak to your practitioner about the way you're feeling or the manifestation of these feelings. And your acupuncturist or Chinese medical practitioner may work with a psychologist or a primary care provider to work together to help you through this problem, or maybe to find the best way of treating the issue. Thank you so much for tuning in today. I'll continue to make these videos so that we can understand a little more how Chinese medicine views emotion. Thank you so much for tuning in. If you have any questions, you can feel free to email me. My email address is on the information page of this channel, and I will continue to make these videos to describe how different emotions can be connected to different organ systems, also to different illnesses. Thank you again. Bye.